Good evening and welcome to RFL. I am Richard French, and tonight we're going to be talking about the presidential transition, the dangers that the president is causing by refusing to concede, while also making big changes at the Pentagon. But before we get to that, for the vast majority of this program, we're going to be talking about COVID. And you, our viewers, will be a huge part of our program. We're going to be joined on set by an emergency room doctor from New York City. He'll discuss the outbreak and also answer your questions. Toll-free numbers are on your screen. 888-766-2428. That spells out to 888-RNN-CHAT if you're east of the Mississippi. For our viewers out west, 855-735-2289, and that also spells out 855-RFL-CATX. And please, if you can, try to make sure you stick to the numbers from your region. It gives everybody a better chance to get through. And if you turn your TV set down, we'll be able to hear your questions really well and also the answers you'll get from the doctor. Now, where we stand right now comes as the virus continues to spread and impact practically every corner of this country. This map, it shows you how widespread the outbreak is now compared to just this spring, when small pockets like New York City, New Orleans were the hardest hit areas. The purple dots, they'll indicate where the virus has struck in March and April, but the brown you see shows where it is hitting now. It is just about everywhere. I'm talking about city, I'm talking about rural, suburban areas. It has picked no favorites here and spared little, if any, regions. All it makes so much harder to fight as people and resources are being stretched to the limit. Now, the numbers, they're getting worse and worse. Now, we have more than 11 million cases in this country. We're averaging more than 150,000 new cases every day. The fatalities approaching 250,000, as we've been averaging more than 1,100 dead Americans every single day. And now the hospitals, they are certainly feeling the strain. Nearly 75,000 Americans are hospitalized as we speak, which is the most we have seen, many of them in, as I said, rural areas, small cities, ill-equipped to deal with this crisis. That includes Iowa, where health officials fear their system on the verge of collapse. And again, those are their words. In El Paso, in Texas, they're dealing with perhaps the biggest crisis in the country. Hospitals, they are over capacity already. This nurse describing a horrific place they call the pit.
I was put in what's called a pit, and in this pit was 8 patients, all COVID positive. My first day of orientation, I was told that whatever patients go into the pit, they only come out in a body bag.
The morgues in that city alone, overwhelmed. Inmates have been mobilized to help handle all the bodies that are coming in. This nurse at an ICU in Utah has gotten used to seeing people die on her watch.
Some days you go to work and you really hope that just someone doesn't pass away on your shift. Some days you go home and you really just hope that your patient's still there the next day.
Things gotten so bad in that state, nurses from New York City now flying in to help deal with the surge in the spring. It was the opposite. Healthcare workers from across this country, they pitched in. They came to the city to help treat the patients. Now, many doctors and nurses describe how helpless they feel as they lose patients, including this nurse in Wisconsin.
This is not something that you want to catch. This is not a way that you want to die. People are dying every night, and there's nothing we can do about it.
Up in North Dakota, this nurse says they are overworked and they are understaffed.
They're just feeling like they're kind of hung out to dry at this point, and we can just continue to give and give and give, but no one's really caring about the nurses.
And this doctor in Bismarck saying the situation in the state of North Dakota so dire.
As we talk about making tough decisions, it really becomes, as you start to run out of space, who gets the next bed? Where does the next patient go? And more importantly, where do you keep patients if there's no more capacity left in the state? The message is simple. The rate of spread is not sustainable.
Just as a reminder, the governor in that state and several other states we've mentioned have pushed back against any mask requirements or even suggested strongly required any mitigation efforts from folks as well. So imagine if you're a health professional in the front lines where you think you're not getting support here from the State House. In fact, you're getting mixed messages making it even harder for you to do your job. Now, hospitals throughout the state of Ohio, they're also having trouble keeping up.
If we don't control the spread of the virus and our case numbers, we won't be able to continue caring for the acutely ill.
So everybody's having staffing challenges. And it's not because they're catching COVID in the hospital. What we're seeing is they're catching it in the community.
And in Idaho, the governor there, he's calling in reinforcements to try and help fight the virus.
Today, I am signing an executive order mobilizing the Idaho National Guard to respond to this emergency and expand capacity within Idaho's medical and long-term care facilities.
Now, if you've noticed, I intentionally went to a lot of states that you haven't heard me talk about before in this program. It's not New York, it's not Illinois, it's not Louisiana, it's not California. You're seeing states in the Midwest, in the Big Sky country, in pockets of this country, including governors in every single circumstance there, Republican governors who push back now. They are hearing the medical professionals in the front lines, and they're saying words like unsustainable. They're begging for help wherever it can come from. And that's the challenge we have in front of us right now. Things are expected to get worse before they get better. College kids are starting to come home from school. There are fears they could bring COVID with them, spread it even to family members. Plus, of course, we have Thanksgiving coming up, and you've heard for a long time the fears from the medical experts, scientists, et cetera, that could be a super spreader event. Take a listen to this infectious disease expert who's explaining the dangers in front of us.
I would love to get together with my family for the holidays, but the worry here is that people get together for Thanksgiving, they're eating indoors, it's loud, no masks because you're eating. If you get together with grandma for Thanksgiving, you're going to bury grandma at Christmas. So that's the challenge that we face, that no one wants to, we all have pandemic fatigue, but unfortunately, if we keep heading down this path, and it is a path to hell.
So things are getting so rough here right now that just about every state is starting to close up things that had recently reopened. Cities like Chicago, they've issued stay-at-home orders. Many others likely to soon follow. The state of Ohio now has a curfew for the next 3 weeks, and that's statewide. California considering instituting one of their own. And now many places that were slow to close down or require masks, they're requiring people to cover their faces, including many of those governors I talked before in those red states. They've just issued mask orders like Iowa, West Virginia, North Dakota, and that's just to name a few. All of this is happening, of course, not in a political vacuum. You've got President Trump, who's MIA. He hasn't met with the Corona Task Force in months now. His people not coordinating with Biden's transition team. The president-elect says that this is a life and death situation, and Trump's refusal to cooperate could have, in his words, deadly consequences.
More people may die if we don't coordinate. So how do we get the vaccine? How do we get over 300 million Americans vaccinated? What's the game plan? It's a huge, huge, huge undertaking.
So I intentionally, and I'm sorry, I gave you all that as a backdrop, and we'll talk about the vaccine certainly, because that is very hopeful news in a little bit. But I gave you that as a backdrop because I think I want to combat this idea that, well, we've turned a corner, or that, hey, now since the vaccine's coming at some point in 2021, we're past it. If only so. I don't like spending an hour delivering bad news here, but the fear that I have, because I'm speaking to people a lot smarter than I am on the front lines, is that we have an unsustainable system right now, and as bad as things are, and I laid out for you how bad they are, they will get worse in November, they will get worse in December, and they will get possibly at the crest in January here. And we are running out of time to change both behaviors and also to give those people on the front lines a fighting chance. So again, I'm going to get your reaction. I'm sure you've got a lot of questions, and this is the right platform for it, and I have the right guest. He's going to be helping me field the phone calls from you and also answering your questions. Dr. Felipe Serrano, he is an emergency room physician with the Mount Sinai system. He's also an assistant professor of emergency medicine. He's helped me out. I remember back in the spring, doctor, when things were particularly awful in New York, and you helped describe the situation there. And now it's multiplied in so many different places. I don't have to remind you of what it was like in the spring in New York. And now a lot of other hotspots are are seeing the same things. Is it your fear and your colleagues' fear that as bad as they are now, 30, 60 days from now, we could be dealing with even worse situations?
Richard, it's good to see you, first of all, but it's really frustrating to have to keep talking about this, 8 months after we went through our experience here in New York. And it's really frustrating to us on the front line seeing that after all the lessons we learned here, there are other places that just decided not to listen to all the warnings that we, gave from the state of New York and New Jersey and the Northeast and dealing with the same situation. And unfortunately, even though we were quarantined here for many months, people were responsible in wearing the masks and following the rules that we were supposed to. The fact that the rest of the country wasn't doing it is probably going to affect us as well here in the Northeast. And so you see these numbers climbing, and you saw that graph you showed of the cases going up, in those multiple humps, and how we're at the highest we have been so far because it's spread everywhere. And as you mentioned, Thanksgiving, everybody's traveling around the country, and people are tired of being quarantined. This is the one chance they get to go home and see their families. And so I think people are going to skirt the rules. They're going to go home, and like the doctor said, you're going to eat dinner with grandma, and really morbidly and sadly, you're going to be burying grandma in December. And so I think Thanksgiving is going to be a disaster. 2 weeks after Thanksgiving, we're going to see these numbers climb even higher than they are now.
So, like you said, there is a fatigue out there, and I appreciate the fatigue. But I think there's also a misperception. The news from Moderna and from Pfizer has been better than we could have expected, that it has a north of a 90% success rate here. And sure, there has to be, further oversight to see about the efficacy of it, but right now it looks legit, and that is fantastic. But for anyone at home who thinks, right around Christmas time they're getting the vaccine, it doesn't work that way. And they'll see the mortality numbers, and while they've gone up and 250,000 Americans dead, I mean, my God. But the numbers aren't corresponding to the positive cases because you guys have learned so much in terms of how to treat. I remember we were talking about ventilators. That's a last resort now instead of a first way. But you're running out of bed space. Hospitalizations, there's not infinite resources. And the people on the front lines right now, and that's what I'd like to talk to, I'm hearing from a lot of professionals that even if they're positive, they have to stay on the job because they don't have backup.
Yeah, you hear that from North Dakota, actually. I don't know if you saw that in the news. Their numbers are climbing like crazy, and their governor passed a rule that if you are COVID positive as a nurse or a physician, you can still come to work. Instead of increasing staffing or increasing resources or mandating that people stay at home and not go to bars or go to restaurants, they're instead asking COVID positive providers to come in and continue working because there just isn't enough staff to cover the hospitals. And you're totally right? We have gotten much better at treating coronavirus, right? And so the deaths from coronavirus itself have decreased significantly as the cases go up. However, what happens is the busier the hospitals are, the less we are able to take care of other sick people, right? So people who come in with heart attacks, appendicitis, you break your hip, right? If the hospital is completely full and all doctors are taking care of other COVID patients, we can't take care of you. And so you're going to have these casualties of patients who don't even have coronavirus, but maybe suffering from other conditions because we are so full, our hands are so full, taking care of the COVID positive patients.
And again, we're still at a rate of 1,500 deaths a day just from COVID alone. And the frustration you hear from so many health professionals is that they can't give the quality care they want. And what I remember is, and you were telling me, even in the darkest days, how it moved you, that people were coming from other parts of the country, even parts of the world, to help out because you were part of a fraternity and a sorority as part of the medical professionals that, hey, I'm going to come to New York to help. The problem is there's so many places that need help. The cavalry can't get to everywhere.
Right. In a way, we were lucky that we were the hardest hit first because the rest of the country was able to come and bail us out in a way. But now when you have every state and every country being affected by coronavirus, they have to keep their resources at home, right? So if you're a nurse working in Idaho, you can't go help in North Dakota because you're taking care of your patients there. And while, yes, New Yorkers can go and help, right, we're not enough. And so everybody's going to be struggling with these staffing issues, and they're going to probably be in a worse situation than we ever were at the height of our pandemic.
I keep you out of politics as much as I can, but people mimic behavior that they hear from leadership. And when leadership calls the pandemic a hoax, when it says that maybe we should try herd immunity here, that masks are an infringement of freedom, people shouldn't have to wear them, or that we've rounded the corner, nothing to worry about, you are the guys who deal with the end results. They come into your ER doors, they're in your ICUs. I don't remember another time in modern American history where medicine and science has had to work in spite of their government, but that's really where we've been for the last 9 months.
Yeah, you know what? Yeah, like you said, I try to stay out of politics in this because it's more important to talk about the medicine, but you are completely right. And part of my biggest frustration is that while the administration did a great job with Operation Warp Speed and getting these vaccines on the pipeline, and they are there, and they've, as you said, they've approved them, they are better than we hoped, they're not enough. Right, and so they won't be ready for several more months for most of the population. And so if we had a good response of quarantining, of masking, of mandatory social isolation, we would have been able to mitigate this long enough for these vaccines to come into the pipeline and actually save lives, right? But by the time these vaccines are deployed to the majority of the population in April, May, June of next year, we're going to have suffered through all that you're seeing there in all these states and the worsening of this curve that's going to happen over the next few months.
One of the things, and I take reaction all the time, but the selfishness, when there should be, there's a common good. You got to look out not just for yourself, but somebody else. But that has been so heartbreaking that we've seen through this. But it's one thing for me to, shake my head if I see somebody not throwing on a mask, but, they're not going to probably be allowed in the store around here, different to a lot of our audience, depending where they're watching me from. But you got to then deal with the end result. And we had a nurse yesterday who talked that she had a patient literally in their last breaths, saying that the virus wasn't real. And you guys are the ones who have to hold up the iPads to the people who in their last breaths can communicate because their loved ones can't come in the door. It's heartbreaking, but it's got to be infuriating because it didn't have to be this way.
Right, and it's hard when as a person, you only listen to one source, right? So if patients are only listening to one side of the argument and all they hear is, the virus isn't really that bad and it's really just a flu and it's really only really sick old people that are dying and most of them are going to die anyway. Because that's what's coming out of some of the news sources that you see. Then even if you're on your deathbed, it just shows you how impregnable that information is, that even when you are about to die from coronavirus, like this nurse is reporting to you, you may still believe that it's not real, right? And so even at your own deathbed, how difficult is it for us to change other people's minds? It's hard.
Well, we have a lot of callers with questions for you and comments as to where we are right now. I'm sure among the questions we're going to get is with the holidays coming up, how do you mitigate that? People are still going to get together as much as they've been warned otherwise. You got family coming from different places, kids coming from college. Also, what's the expectation for the vaccines? So much to get into with Dr. Serrano. When we take a break, on the other side of it, we will take your questions and comments. You see the toll-free numbers right there on the screen. If you're calling me from anywhere up and down the eastern seaboard, you see the number 888-766-2428. And for those viewers watching us from California, Texas, and western Mississippi, please give us a call at 855-735-2289. Those calls and much more when we come back.